Welcome back. Joining us in the studio today is Dr. Mark Hackbarth, a pain management physician with UT Health East Texas. Thank you so much for being here today.
Thank you. Glad to be here.
Absolutely. We're happy to have you. So is pain management mainly achieved through pain medications? I feel like that's kind of a debate going on right now.
Well, a lot of people think it is, but actually we try to avoid pain medications. As you well know, we have an opioid crisis, and the problem with most pain medications that are opioids, they're addictive, and then also if you take them long enough, they can actually make your pain worse. So we try to avoid those if at all possible.
So what is a preferred way to treat pain then?
Well, we try to use non-opioid type medications for one, and usually in a combination with physical therapy and sometimes injections for diagnostic as well as for therapeutic purposes.
So what types of pain problems do you treat? Are we talking like headaches or like broken bones?
90% of everything we treat is spinal problems. Usually it's chronic pain that's been there for a while. The spine accounts for probably about 90%. We do treat some nerve type pains, whether it be neuropathies or neuralgias. Somebody who has shingles and then the pain that persists, and those would be the type of patients we'd see.
Do you have any advice for maybe athletes that, kind of preventative to avoid, maybe they don't see you after they're having that pain, maybe they prevent it?
Well, I think one thing is to maintain flexibility. That's a big issue. The other thing is to try to avoid being overweight, because that puts extra stress on your joints. And then lastly, avoid tobacco products, because tobacco products typically decrease the blood supply to joints and discs and such, and so it make you a little bit more prone to injury.
Yeah, what's the best time to seek treatment then?
Usually I think earlier is better than later, but if you just have an acute injury, I usually recommend seeing your PCP first, and if for some reason it doesn't seem to get better, or it's of such a severe nature, then it's usually a good idea to go ahead and have us be seen.
Yeah, is there any specific type of back problem that you see more prevalent in our area, maybe right now?
Well, a lot of it has to do with patient's age. Usually a younger person typically has more disc problems. As we get older, we tend to have more problems with our joints, and sometimes as you get older, the canal in your spinal canal gets smaller, and that can lead to problems with walking as well as back pain as well.
I feel like I've read a lot that people with, always on the phones, computers, kind of have a posture problem that causes back issues.
Well, that is true, and we live in a much more sedentary lifestyle now, which makes us a little bit more prone. And a lot of people do a lot of computer work, which if their neck flex can cause some neck problems as well. Or the other one is with their telephone cocked over next to their ear, they can cause some joint discomfort.
Dr. Hackbarth, if people have more questions for you, where can they find more information?
Just contact UT Health East Texas, and then look up the pain management, and then we have there at the website, and then they can, if they want to contact us for make an appointment, they can do it that way as well, or have their primary care physician make a referral for them.
Sounds good. Thank you so much for stopping by this morning.
Thank you.
Coming up,